What's up, guys? In this video we're going to talk about ankle injuries and their treatment. John the PT is going to walk us through it, so let's get started.
So what we're looking at here is the foot and the bones of the foot, and then on this model over here we have the fibula, which is a bone on the outside of your leg, and then the tibia, which is the bone on the inside of your leg. Usually ankle sprains happen when you tear or strain one of the ligaments that holds these bones together. And there's three different grades of sprain. There's a grade 1 sprain, which is usually a stretching of the ligament, a grade 2 sprain, which is severe stretching of the ligament, and then a grade 3, which is usually a complete tear of the ligament. So the most common type of ankle injury occurs on the outside of the ankle, and it's usually the talus and the fibula and the ligament that attaches there. So it's called the talofibular ligament, and that injury usually occurs when you turn your ankle in. So if you're a basketball player and you come down on the other person's foot, you usually turn your ankle in, and that's called an inversion ankle injury. The second type of ankle injury is a medial or inside injury, and it usually happens with the deltoid ligament, which is on the inside of your foot here. And what happens there is, you could step into a hole, or it's a more forceful movement, but that injury isn't as common, and that's called an eversion ankle injury. And the last type of ankle injury is called a high ankle injury, and that occurs between your tibia and fibula, and there's a fancy name for that, syndesmosis. And that's less likely to happen, and it usually involves a couple different movements that are happening at the same time. It's usually a twisting movement and then an up and down movement that happens very quickly, and it involves just the ligaments in between here. And that injury doesn't cause as much swelling, but it can also be a little bit more chronic and longer lasting. So you're playing basketball and you come down on somebody's ankle, and your ankle moves in, and your foot feels a little bit sore, but you can keep playing on it. And that night or the next morning, you wake up and you have a little pocket right in this area full of swelling. That's what we would call a grade 1 ankle sprain. So again, you're playing basketball and you jump really high and you come down on somebody's ankle, and it's a pretty ballistic movement, and you feel your ankle really turn and you have a hard time getting off the court. And that night or the next morning, you have like a softball size ankle out on the side here. That would be considered a grade 2 ankle sprain. And then finally, I don't have a balloon here, but you fall on the court, or you step on somebody's foot on the court, and you can't even put weight on your ankle to get up off the court. You have to have some assistance. In that case, you may even want to get your ankle x-rayed, because there is such things as avulsion fractures. But you'll know because your whole foot will be swollen, all in this area down here, and it'll encapsulate the whole ankle. And that's a grade 3 ankle sprain. Okay, so you sprain your ankle the night before, and you wake up in the morning and you're having a hard time walking to the bathroom and your ankle's really swollen. So one of the things you want to do right away is try to get rid of some of the swelling. What I have here are 2 ice compression units. Okay, this unit, which is the game ready unit, is mainly used in clinics. So you're not going to be able to get a hold of something like that, but you may be able to get a hold of an air cast. You can buy this online, and what happens is you put your ankle in here and you put a lot of ice and water in here, and it does plug in, and then you get your ankle up high and you do some ice and compression on it 4 or 5 times for the first day to try to get some of the swelling out of it. If you do have to walk around on your ankle, I would suggest that you get a tuba grip stocking, or you get some other type of wrap that you can put around your ankle. You don't want to put the wrap on too tight, but that will help with the swelling. So there's a couple different types of bracing or putting pressure on your ankle so it doesn't move around and give you any more pain. For a grade 1 ankle sprain, you might get away with just a tuba grip stocking or some type of an ace bandage that you could put on it. You'd wrap that around it. For a type 2 ankle sprain, you might get a little more support from a McDavid ankle support. And that just laces up in the front and it really holds your ankle in place so you're not going to get a lot of movement from it. Also, for a type 2 ankle sprain, you can use an air cast, and that really holds your ankle in place. Then for a grade 3 ankle sprain where you'll probably be completely immobilized, you'll end up being in a cam boot or an air boot. The wobble board is a good exercise to do to start to get some of your range of motion back. You want to control your knee and have it right over the wobble board, so slide out a little bit. Okay. And then just go around in a circle, pain-free. Initially when you start it might be a little bit painful, but just go around in a circle and try to touch the edges as you go clockwise and counterclockwise. If it's painful, then you can just move it forward and backward and then in and out. Another thing you can use to get ankle plantar flexion and dorsiflexion back is the pro stretch. So you're just going to lock your heel in the back of the pro stretch while you're sitting and just go up and down, forward and backward in a pain-free range. If you don't have those toys, then you can do a very simple exercise for range of motion. Just put your leg up on a stool, move your foot up and down, leg move in and out that way, just move from your ankle. So in and out, and then up and down. Easy active range of motion. The next exercise you can do is to go against some gravity. So Chris is going to let his ankle drop down a little bit and then come up and down and up. So just put a couple pillows up underneath your leg and make sure you stay on your side, that you don't roll back like this, and just move your leg up and down. This one's a little bit more difficult to get used to, but you can see Chris is lying on the same side that he's working, just moving it up against gravity. Okay, now Chris is doing sitting dorsiflexion against gravity. And again, keep your knee stable and move your foot up. So he doesn't have the weight of his whole body, he has just the weight of his leg moving up and down. So they're the easier ankle exercises to start with. So for the first resistive exercise I'm going to show you, it's going to be ankle inversion, and just going to wrap an easy band, TheraBand, around the table. Try not to move your hip and knee too much, and just pull your ankle in. If this is painful, then don't push through it. Your ankle needs a little more time to heal before you start this. This is ankle eversion. This might be a little bit more painful in the beginning because, as I said earlier, the most common ankle sprains is out in this area of your ankle, and that's what you're working. This is plantar flexion, and this will probably be the easiest of the exercises that you do with the TheraBand. So you might want to start with this one. And just go slow and controlled. You don't have to go all the way up and all the way down. You can take the band and you can wrap it around something stable, sit on the ground, and then back away till you have some resistance. Or you can have somebody help you out and hold the band while you pull up and down into dorsiflexion. All right, so now you're at the part of your rehabilitation where weight bearing is not as painful. So you're going to start to do some weight bearing exercises. This is called a balance board. It goes forward and backward. And you can start with both feet on the board and maybe stay on there for about a minute. And then turn the board in the side-to-side direction and go down, bending your knees. When you go to the left, your right knee bends, and when you go to the right, your left knee bends. Then you can progress from both legs to one leg. Okay, if you don't have a balance board, you can just try to stand on one leg and maintain your balance. And then the next progression to single leg stance would be single leg stance on a piece of foam or a pillow, and just trying to maintain your balance. So once the swelling is down, you have the range of motion back, you can do some easy resistive exercises, you don't have any pain walking, You're going to move to the agility exercises before you get back to sport-specific exercises. Chris is just going to demonstrate this one for us. So that's lateral movement. That puts a lot of pressure on the outside of your ankle. You can also do a number of exercises with the ladder. And you want to be up on your toes when you're rehabilitating your ankles. Some side movements, and then some coordination drills in and out. And I would do like 10 passes of each. The exercises that I talked about today aren't all inclusive of all the exercises that you could do for your ankle, but they are a good start with things. Remember, if your ankle's really swollen and it hurts a lot, get yourself to an orthopedic doctor to have it checked out.
Thanks for watching, guys. If you have any other questions, please leave them down below. If you have any other requests for videos that you want to see in the future, please leave them in the comments. And that's it. I will see you guys in the next one.